All right, welcome all to our webinar, Lunch and Learn webinar today, focusing on client pathing, in which we're going to be talking about goal planning, target tracking, and task management. For the old faithful here, EMHR customers have been with us for quite some time. I'm sure you're going to recognize a lot of these modules, but we do have some additional enhancements and things that we're going to be talking a bit about. It's also going to be a good opportunity for some of our newer workers or newer agencies to hop on board to learn about these different modules and how they can help contribute to proper client golden pathing so you can do a good job of managing and just looking over a client journey as they move through your image or database. So my name is Jamal Tekla. I'm the manager of account management here at EMHware, and we have Sarah Alali, our senior product manager and our product lead here at EMHware. And a little bit of housekeeping today for our webinar. We will be presenting on, of course, all of the modules, and we'll talk a little bit about why not use case notes, key benefits of that. We'll undergo a demonstration. We'll talk about some new and already planned enhancements, and then we'll engage in a Q&A. For folks that are not familiar with Zoom's Q&A, if you look at the bottom of your screen, we do have the Q&A function. Feel free to enter in questions into the webinar chat, and we'll be able to address those either at the end or if it's quite topical during the discussion. And I'll be here to help moderate the Q&A as we motor along. So with that, I think we can go to our first item of the day. So I'll hand it over to you, Sarah, and we will motor along. Thanks a lot.
Thanks, Jamal. Really appreciate your partnership in moderating today, and also really appreciate everyone's time joining us this afternoon for Lunch and Learn. I'm Sarah Alali, pronouns she, hers, and I work to kind of develop the product, the EMHware product roadmap and help guide designs, translating them from clinical needs into actual development. So I work closely between our clients and our development team. And with that, I did want to lead off today with a forward-looking disclosure, just because today we'll be looking at some of the intentions and some of the vision that EMHware has for the future of these modules. However, as is the nature of innovation, there is always unexpected things that may pop up in our environment over time that may require us to kind of shift gears or reimagine what it is we're trying to devise with regard to EMHware. With the three modules that we'll be reviewing today, we will share with you some of the vision that we have to harmonize them, make your workflows more efficient for the folks that are on your team, and ensure that there's better visual management to keep a closed loop on some of the commitments you make in your care plan with your clients. So all of these things we have intentions of doing, and um, and again, as we kind of put pen to paper and start the development, sometimes there are unanticipated barriers that we have to work around. So the designs might shift a little. So that's the intention of this initial forward-looking disclosure. And we look forward to sharing with you all kind of our vision for the goal planning, target tracking, and task management modules, and how they can be harmonized in the future. So with that, stepping back, it might seem like it might seem kind of like a lot when you're thinking about onboarding three different modules to support your clients with regard to goal planning, target tracking, and task management. And really, what I wanted to emphasize here today is the fact that if you're using your case notes primarily to document things like validated assessment, clinical assessment measures, and the clients' goals and the actions they're taking and the progress they're making against those goals, it can get kind of lost in that large, rich text field. And so part of the work that we're doing on the EMHware database is to make it more streamlined to capture discrete data. And the value of kind of capturing this information discretely using these modules is that it enables two things. First, the discrete data enables us to automate workflows down the line as we continue to innovate the EMHware product and enhance the efficiencies that your workers can enjoy. And then it also enables reportability. So if you think about it, if you have one large text file, that doesn't give EMHware enough information to really send out notifications or even visualize on a graph the patient's progress. So it's important that we have the ability to document things like target tracking and goal planning discreetly so that over time, EMHware can help automate some of those workflows, improve visual management, and reduce gaps that could potentially arise in the delivery of care when your team is just reading from large text files like a case note over time. So I wanted to ground ourselves in this idea as we're looking at the modules in a deeper fashion. So I also thought it would be helpful to level set because some folks on the call may never have used any of these modules. So kind of level setting on what the use cases are for each of these three modules is important. We're doing one webinar with all three of these modules, but they are available independent of each other, and there are unique use cases for each. So if we start with goal planning, I think the best way to conceptualize our goal planning module is a tool that can be used to enable your clinicians to work with their clients collaboratively and really get the voice of the client built into the goal plans. So you have your client stated goals and you have the collaborative action plan between your provider and your client. And that can all be documented in the goal planning module. And it enables you to show almost a way to measure behavioral progress as it relates to the client's actions toward that goal. Target tracking is slightly different insofar as it is more quantitative. You can almost envision this as a place to manage measurement-based care over time. Also, if you're not to the point where you need to solely, to entirely move into the measurement-based care arena, it is helpful also to monitor progress on specific clinically validated assessments to measure client outcomes. And then finally, task management. It can be used in a pretty broad way. We'll look at the task management module today in a very kind of concise view. But what task management enables you to do is a couple things. It enables you to schedule activities that your clinician has to take, such as following up on the GAD-7, for example. So your teams and staff are going to be able to kind of create their own workflows in ways that they get reminders to take action on a given task for a given client. It also helps collaboration on the team side. So it enables workers and their supervisors to communicate within the platform in ways that you may kind of want an added double check to ensure that the supervisors are able to oversee specific tasks that might be high relevance or high priority. And then finally, some enhancements we'll be talking about is engaging the client with regard to tasks as well. So, one of the things that we want to do, you'll see later, is the ability to share tasks to the client portal so that clients and caregivers can review and interact with those tasks in a little more robust way than they're able to do today. So that is kind of the high level summary of the use case of each of the modules. And now we'll take a look at each one a little more in depth. Again, these are going to be brief, brief demos that that I'll share with you. And please drop your questions in the Q&A and we'll address those at the end of the session. So
I'm going to
with
click on the
that,
client menu.
I am going to pull the goal planning video over here. Thanks for your patience.
I'm going to click on the client menu and scroll down to goal
Were you
planning.
able to hear that, Jamal? Okay.
And here I have a list of Johnny's previous goals that I've created for him. And I'm going to hit new here. So the date automatically populates to today's date and time. And we have our client that we've already chosen, the worker, and the program. So I'm just going to pick that. We have the status. We can pick whichever one is applicable, but I'm going to keep it to in progress. We can publish in the client portal. We can add comments and attachments. And we come here to add a new goal. So again, the date populates to its date and time. And we also have the category, so it can be a treatment, behavioral, dietary, or safety goal. I'm going to make this a dietary goal, and I'm going to set the priority to high. So the goal, we can write anything really, but for Johnny, I'm going to say we want to reduce sugar intake by 75%. I can change the status of this goal, but I'm going to keep it to in progress. We have the status date, the status reason, and we can add any comments about the status as well. So we can create an action plan for this goal. So I'm going to create a new action. I'm going to say by next week, he has to stop having ice caps for breakfast. And that has been assigned by me, so I'm going to make myself the assignee. I can add an assigned other, and here we have the completed portion. So we can add multiple goals. So for the week after, I'm going to say he has to have drink 8 cups of water a day. And for the final goal, I will tell him to stop eating processed foods. Okay. So once I save this goal, I can actually add a new goal to this file. So maybe there's a related goal, say that he has to lose 20 pounds. So this is going to be behavioral. Lose 20 pounds. Again, we can put the status date, reason. I'm just going to add a new action for this one as well, so we can see what that looks like. So walk 10K steps per day. Okay. So I saved that. Now, once I go into his goal plans, we will see right at the bottom here that he has a goal that's in progress. So we see that he has 2 goals and that 0 of them are completed. So I'm going to go ahead and click on this goal. Let's say that Johnny was doing so well that he completed this on the first day. So I can just go ahead and complete. I can add the date of completion, and I can add any comments that I want as well. So another thing I would have to do is go ahead and change the status of this goal. So since he's completed all goals, I can go ahead and click achieved. So once I do that, I'm going to go back to goal plans here. And it will let me know that one of my goals have been achieved. So I'm going to go back and complete both so you can see what that looks like. So I'm going to go to the behavioral one now. And I'm going to complete this one. Again, change the status to achieved. And in order for this entire goal to be listed as completed, I would have to go to the top here and change the status to completed. So once I go back, it will tell me that the status of this goal is completed. and that both of my goals have been achieved.
Okay, so that is the high-level goal planning review. I do see some questions coming in. If Jamal, feel free to type them as you go or respond as you like, and then we can address any unanswered at the end.
Sounds good.
So that was a review of our goal planning module at a very high level. So there is more to see, and if you're interested in hearing more, about that, you'll want to reach out to your account manager and they'll be able to give you guidance on how to enable goal planning. And upon enabling goal planning for your agency, an implementation specialist will go more in depth about how to set up your goals and same for task management and target tracking as well. With that, I'm going to hop into the brief target tracking demo.
So I'm just once again going to go through the client file to show you how we can create a target for the client. I'm going to go through the client menu and find target tracking. So here we have all of the targets I have created for Johnny and our search parameters, and I'm just going to go ahead and click new. So again, the start date will populate today's date. I will give him a target date, which can be at the end of December. I'm going to pick a program, a worker, and an area of focus. So once I pick this area of focus, it's going to give me a couple of targets. I will use the Promise Emotional Distress Anxiety Parent Report. And so in the target tracking administration, we can actually create these aspects of the target right here. So we can add a description, a tracking scale, a minimum and maximum score, a scale increment, whether a higher score is better, and we can add a recommended retest frequency. So we also have an anticipated session frequency. It's going to keep it to 7 days, but we can edit that if we want. We can add bi-weekly, we can have a monthly, weekly, or yearly. How often I will track the target. And so once I save this, if you can see the active button isn't available right now, but once I save this, I will be able to make this target active. And once I do so, if I save it again, this will become read-only. And then I can start adding my scores. So I can just do that right here, add a score. So in this gray area over here, we can create a contact note if we wanted to. Maybe we don't have the assessment within EMHware, but we wanted to report on their assessment. So we have that right here. But we also have assessment right at the top. And if this assessment is already in the case data, you can just go ahead and fill it out. So as I fill this out, it will be, oh, not yet. As we go through this, it will automatically populate the score to the correct score. So right there. And so we have that. If we used an assessment outside of EMHware, we can actually just do this manually. And we can just add it like that. So yeah, so I'm just going to save this. And right away, we will get a visual representation of our scoring. So this is great. So if I had another score that I wanted to add for Johnny, so let's just say, I'll just add that. We have a visual representation of our client's journey through this target. We also have the written version right here. So we have the score ID, the date, the scores. So if we made a contact note, we would have the contact ID, and we also have the case data ID here too. So I'm going to indicate what the outcome was if they're, done with the target. So we can say target met. We also have a couple options over here, but these again can be added in the target tracking administration. We have an outcome other. So if we had another outcome, we can write that here. And we have a completed date. And we can add any attachments as we wish. So once I authenticate and save that, this all becomes read-only. So,
And that was an overview of the target tracking module. I will show you all briefly going back to Lynette's question. Oh, there are balloons in your background, Jamal. Going back to Lynette's question in the chat, she asked if there's a way to print out the goal plan for the client. And so, yes, there is a print button when you're in the gold plan, and it launches this screen that enables you to select or deselect various sections. It's not extremely discrete at this point. We do have plans to kind of optimize how we're enabling you to select what you'd like to print or not. But it is formatted very similarly to what you see on the screen. So you would be able to print this off and provide that to your patient by clicking here once complete. And then finally, we'll do a brief review of task management here.
So we have the from date that automatically populates today's date. And we have this great feature. If there's a task that you have to do and it's in a certain amount of days, like 120 days, if you enter it right there and click enter, the due date will populate with the correct date for that. So I might not know what 120 days is. I can just enter it there. But for now, I'm just going to leave that to a week. I can pick the program, the worker, and for the purposes of this demonstration, I'm going to make myself the supervisor. So I'm going to, where am I? There I am. I can add any attachments, and I've already chosen my client, so it's right there. And so I'm going to pick my task type, and this is actually really cool because these are all case data forms. So if you wanted to create a task that's just empty and you just wanted to remember to do something, for example, like a follow-up, you could just create one like a contact note in the case data section, and it'll show up in here. So for example, we have a follow-up right there, and it'll just look like a contact note. But for the purposes of this demonstration, I'll just use an assessment tool. So I'll use the GAT7. Okay. So once I save this, there will be an email notification sent to the worker and and it'll show up on their dashboard that they have to complete a task. So once they go on their dashboard, so it's due on the 13th, if I go on my dashboard, I will see that I have a task due on the 13th. So I'm going to click on it, and it will tell me who it's for and what it is. So once I click on that, let's say that I met up with Johnny and we're just going through the GAT7 together, going to fill it out. Okay. Then I'm going to authenticate and save this. It's going to show up on the supervisor's dashboard, and the supervisor will get an email notification where they will come and review it. And since I authenticated it, it's read-only. But if the supervisor realizes that something hasn't been completed, they can unlock. So for example, the last question has not been completed. They can unlock, give a reason as to why they're unlocking, so incomplete information, and they can make any comments that they wish. So did not answer the last question. Submit. So now this is in the workers' court. They will get the notification again. They will come to this page and see that it has not been authenticated because there's incomplete information as they did not answer the last question. So me as the worker, I'll go ahead and the next time I meet up with Johnny, I will answer the last question. I will authenticate. And so this back and forth can happen until the supervisor just gives their signature and approves. So once they authenticate and save, this will disappear from both the supervisor and the worker's dashboard. So that's task management. And this is really great for those who don't want their clients to fall through the cracks, and they can find an area in the system that will tell them which tasks they have to complete.
Oh, great. And one of the other things that I want to call out here that we didn't quite capture in the demo was that on your global dashboard, if you're using tasks, you're able to set it up so that the tasks are also displaying based on their due dates for across your calendar. So as your staff is coming in for the day, if you're leveraging task management, you can also kind of enable them to enhance their daily workflows and get an understanding, when you're first arriving in the morning of what needs to be done, throughout the course of your day to ensure that those tasks are being completed. So the task module is, we saw a demonstration of it being used with case data, which is I think Claire was curious how case or standardized assessments fit in here. if you are building those using case data, you can leverage tasks to ensure that the standardized assessments are scheduled at the proper cadence for your clients to fill out. And I think that is, and we'll come back to this shortly when we're looking at kind of the vision of what we're hoping to do with EMHware. But tasks can also be used for more kind of back office activities as well. It doesn't have to be limited to clinical activities if you're, just working with your team to collaborate. So now we'll kind of move into some of the recent enhancements that we've built since I guess in the last couple months. Actually, they've been in our beta testing, but they're also ready to be generally available. So if you already have if you already have goal planning, for example, let us know and we can help you enable this new enhancement, which is the long-term goal. So essentially, we've identified a need. There are, of course, the goals and actions that you saw on the demo that are what I would call kind of short-term goals. And then we've enabled the ability for your organization to turn on a long-term goal for the client's encounter, basically. So the long-term goal will sit at the the client level. And you're able to define a long-term goal and why, kind of the justification for that long-term goal, why it was chosen as kind of the primary focus for their reason for visit, basically. And then you're able to more easily demonstrate how those shorter term goals and actions are feeding into that longer term goal. So that is a new feature we've added recently. And then with regard to task management, we have recently enabled the ability to select a case note type. And the advantage here, what we've seen actually was there's a use case for some back office work as it relates to the ability to use case notes with tasks. Um, One of the examples was perhaps there's a letter back to your reference that you're obligated to provide, maybe a letter to the primary care physician, for example. Um, Essentially, as a let's say you're the social worker working with a client and they're preparing to discharge from your program. So you have to provide a letter to their primary care provider, informing them about the course of their care or the completion of your program. You can create a task to go to a certain administrator or clerical worker and use the case note type to attach that letter to primary care. And you can send the task to your clerical workers to print and distribute the letter to primary care. So, as I said, the tasks aren't necessarily specific to clinical applications in EMH, where they can definitely be leveraged with a more fulsome approach by your organization to set up workflows that streamline care collaboration among your staff. And then some of the things that we know we have coming soon is the ability to share a more robust task interaction to the client portal. So perhaps you're wanting to task your clients to take the GAD-7 every maybe every week, every 7 days. You could share that to the client portal in a way that enables the client to complete the task, and it would be fulfilled in EMHware. So expanding that inner office collaboration to the clients for more fulsome interactions on the client portal and an ability to gather clinical assessment data, for example, asynchronously, so without the need for a clinician to meet with that client. Also looking to develop the ability to capture client or caregiver signatures in the tasks view. So if you are working with a client and their caregiver face to face, we're going to enable you to authenticate a task and then capture the client or caregiver's signature to sign off. And this was also feedback that we received as one of our clients were preparing for a CYFSA audit. So if you are someone who is reporting to MCCSS, this is going to be advantageous to you going forward as well. And then we're also continuously improving the visual management regarding near due or overdue tasks. I shared with you how it's available in the calendar view, but we're also looking at distributing email notifications to the assignee of that given task and better visual management in the EMHware application to identify tasks that are coming due or overdue that need attention urgently. And to kind of close out our discussion today, I wanted to share with you EMHware's vision for these three modules kind of coming together as a single unified care plan workflow. So I think some of the questions I've been observing in the Q&A kind of lend credibility to kind of what we've been hearing from our other partners as well, is that, you know, it's great to have each of these independent of each other, but it would be so much more efficient to unify them under kind of a single unified client care plan. So our objective, looking ahead, I would say, looking ahead to the next 9 to 18 months, our objective will be to put together kind of a unified care plan workflow. So what that will look like is the ability to set goals, associate targets with those goals, the quantifiable targets, and then essentially trigger tasks downstream. So if we think about it from a hierarchical point of view, you have the long-term goal of the client to basically to achieve what they're wanting to get out of this episode of care. And then you have shorter term goals that feed into that longer term goal. And then you may be using quantitative assessments to measure success on certain items that feed into their achievement of a given goal. And often there are tasks associated with those actions as it relates to building into those short-term goals that feed into the long-term goal. So this is kind of a summary of the vision that we see for the unification of each goal planning, target tracking, and task management. And we'll certainly be interested in getting getting feedback over time. As I said, we're looking at this in about 9 to 12 months or so. So we'll be starting to engage clients early for feedback sessions. And of course, Jamal and the account management team is always a great open ear if you have any recommendations before then. And that's all we've got to review today.